Hi, Rob Lamb from Newfound Strength Fitness and Nutrition, corrective exercise and tissue mobility specialists. So today we're going to shoot a video series on calf work. So we're going to run through a plethora of different methods and modalities. We're going to have self-myofascial release from foam rolling. We're going to use a foam roller. We're going to use a few different sports balls. We're going to use our hands. We're going to use our opposing knee into one calf, and we'll use our opposing shin into a calf and the Achilles, showing you a variety of different methods. And of course, we're going to use the world's single most effective way of loosening tissue, which is resistance stretching, and we'll of course be using self-resistance stretching. So let's get started. So calf work, right? So one of the ways I'd like you to see if you can check yourself diagnostically, can you hold a squat position down low without falling down? So if you can't do that, then your calves and shins are probably tight. Now we're only going to address calves in this video, but your shins are going to be another piece that you're going to have to work on. So let's kind of start from some easy modalities and techniques and move our way up into things that are a little bit harder. So we could do a basic stretch position. We're not going to work through any static stretch positions. We're just going to focus on some the techniques we talked about. So we could start off with just trying to use a tennis ball, something easy, something light, put underneath that calf. We'd start right, where would we start? We'd start right in the middle where you've got the most meat, all right? Where you have the most muscle is where you're going to have the most tension. As a good likelihood, good starting place. So I've got that foam, that tennis ball right smack in the middle of my shin and in the widest part of the meat, all right? So now what can we do with that? Well, we can sit still on it if once we find that tender spot, or we might move around a little bit. We have a few guidelines. We call it 3 M's and a T. You should only have a moderate sensation of uncomfortableness, should not be pain. If you're in pain, you're working too hard, you're putting too much pressure, you're moving too fast. And second M, manage to relax. You shouldn't feel tense, you shouldn't feel tight, you shouldn't feel like you're flexing and guarding against that tennis ball or the foam roller. You shouldn't feel like you're having to hold your breath, and you shouldn't be sweating bullets. Third M is modify. If you can't answer yes to number 1 and 2, then modify. If the tennis ball hurts too much, then seeing how this is a small item, you might bring in a wide item so it covers more tissue. This is going to feel a little bit easier. Those guidelines, it's 3 M's and a T. The T stands for time. It's going to take a little while. You have to be patient. Going back to number 2, manage to relax. You think of it like this. The time doesn't even start until you've actually relaxed. So here I've got the foam roller, and I'm again starting right in the middle. Let's say I really don't find anything. What would I do? I would probably want to lean into it a little bit, or maybe put some extra weight into it by crossing the leg over. How else could we put some extra weight into it? Well, we might bridge up and lift our hips up, and that would put more weight down into it. But if you don't have really strong shoulders and you couldn't hold this position for 10 minutes easily, I would say you're probably not going to be able to manage to relax. You'll be so focused on how tired your arms and shoulders are, you won't be releasing your calf muscle. So we could just put some weight into it. We could lean into it. We could cross that leg over. Might put our hand on it. If you got a super friend that comes down, sits down next to you, they could maybe lean down, put a little bit of weight into it. You tell them how much weight to use. And we're going to go move up and down through that entire calf bit by bit. You're going to look for all the tender spots, trying to get everything that feels tender out of there. Tenderness equals tightness. Tightness is what's holding you up and causing you problems. We're going to work all the way down to the Achilles tendon, okay? So how many different types of foam rollers are there? There's white ones, which are softer ones. I'd recommend people start off with a white one. The blue ones tend to be harder than that, and the black ones tend to be the tightest and the firmest ones. Here's a great foam roller. There's knobs on it. So it has protrusions that are going to stick into the tissue lightly. They're not very big, and these are dull. And this is going to actually be better and more productive than the flat roller because it's going to be able to sink into some of the tissue but not all the tissue. What are some other movements we could do? Well, cross friction, moving 90 degrees to the length of the tissue. So as your calf, you can imagine it's going to run up and down the shin. So if I push down on this, push down on my leg just a little bit, only to the point that it's moderately uncomfortable, I found a tender spot, and then I'm just going to work that leg back and forth at a relatively slow pace. What if this pace seems too fast, it's too intense? I'm going to slow it down. It might look like you're moving at a snail's pace back and forth, and that might be exactly what you need, right? So you're going to go up and down through the calf. So I would recommend finding one of these and grabbing that. So now let's move on, getting through our stuff. Different size balls, so we could go from a tennis ball, something that's soft and small, all the way up to here's a full-size softball. To get that taller item, the higher the item, the more it's going to sink into your calf. So we had talked about just working with your hands. So you might, a good thing to do might just be to take your thumbs, get in a comfortable seated position, throw your back against the couch, and just work through your thumbs, just work through that tissue up and down, trying to find it and actually working through that. So, and then again, once you find something tender, then that's tightness. Tightness has got to go away. You're going to just work on it very slow. I'd recommend going easy on your hands. You'll wear out your hands. Now, what would be an easier way to do this on my hands? Well, I might want to turn over. I could come up through here, and I could now take a straight arm, and I could sink down, and I could push and lean my body weight through a straight arm and push down, and I could find that tender spot, and Can make sure my wrist is straight and not bent and crooked. That's going to wear out my wrist. And I can just hold down right through there. And we can sit still, breathe, relax. Maybe you have your hand here on a table so your body, you don't have to work on holding yourself up a ton. And so you can manage to relax more. Once that tissue there is loosened up, I'm going to move down range. A minute or so later, when that's loosened up, I'm going to move down. A minute later, I'm going to move down. And I could sit back and I could just keep working all the way back into my Achilles tendon. So now I'm moving back and forth across. So I'm basically doing that cross friction again. Nice and light to the point that I feel that's complementary. Okay, then now it feels better, but it feels like there's deeper tension. So I'm going to push a little bit harder. The amount of tension you use is, of course, going to be on par with what you feel. So if you're causing pain, it is your fault. So ease off. Now, what if I'm starting to feel like my ankle doesn't like being flat here? We can grab a foam roller, put it underneath here, put a small pillow underneath here, and now your foot and your ankle can stay bent. It'll be more comfortable. But then ultimately, that's telling you that there's a lot of tension across the front of your foot, ankle, and your shin that's going to have to get worked out. And if your calf is tight, your shin is tight. No two ways about it. And so working through here, and now I can sit back and work my Achilles tendon. I can get in here nice and easy. Maybe I want to work on my foot a little bit. Okay, so now what if you're saying, well, my knees aren't very comfortable in this position? Thankfully for you, we have some quad stretch videos already done. You can go and find those. All right, and what if you happen to have a boomstick? 22 pounds of glorious aluminum and steel. Well, in this case, I would come into this kneeling position. I would gently and lightly lay it across my calf. I would only let as much weight sink down into it as I could handle. And I would slowly roll this down. For the sake of time, I'm showing you, just rolling that down. And you only go at the pace that you can tolerate. If you're in pain, you're causing it. Slow down. Use less weight. Don't move as far. So we've got to get to the world's single most effective way to loosen up tissue. That would be resistance stretching, self-resistance stretching. So I'm going to grab a band or a yoga strap, or I'm going to get my web belt out of the closet. I'm going to put the band at or below the ball of my foot, slightly onto the arch of my foot so it doesn't slip off and hit me in the face. And I'm going to sit up or lean against the couch, get into a comfortable position. I'm going to contract the muscle that I want to stretch, which in this case is that calf. So that foot should go pointing out there in that direction. And then we would gently pull back with the arms in a rowing manner. Come back. Go back. Once you come to the in range, you can't pull it back any further. And of course you resisted the whole time. We'd go back out for another rep. Push out, hold. Pull back on the foot through the band. And if you want to do a resistance stretch, a static stretch at the end, feel free, go ahead, especially if you're feeling tired from doing multiple repetitions, because you're going to need to do dozens of them to get the results. And push out again, hold, resist. I am trying to point my toes. I'm doing a calf contraction right now, and then I'm resisting through my calf as I overpower it with my arms and my back to pull and row. Okay? Now this bouncing action, the rowing, that's not something you're going to do. I was just trying to show you that I was pulling. Point out again. Drive through the foot and pull back, row. And let's all take a quick second and look at those shoulders. Make sure the elbows and shoulders are down. We don't want to be pulling and having your arms up here. We're just going to create a neck and shoulder problem while we're trying to fix our calves. How could we advance this a little bit further? If we were laying down and we brought the leg up, then we would have the hamstring stretched out, and we would just be doing the exact same thing, pointing my toes up, bringing it down, and now you're probably going to feel much more sensation crossing from the calf into the hamstring, and that's fine. What you don't want to feel is a ton of sensation in the knee joint, behind the knee joint. That would tell you you're primarily stretching the tendons too much, and also you're probably not actually contracting and holding the contraction. You're probably just doing a static stretch, which is very common to just wind up overstretching tendons. So if you push off, do the calf contraction, pull down on the band while you're still contracting your calf, and then you get to the end, you stop. You go back up and you come down again for multiple repetitions. How many repetitions? Hi there, we're going to get to refinish the end of the video. As you probably saw when I came up, I hit the clicker with my foot there, and we were in the middle of talking about how many repetitions you need to do. Well, you're going to need to do dozens, literally dozens, but this is what's it's going to take to make you feel better, years better. This is going to fix chronic problems you've had for months and or literally years. So try to do a dozen with one limb, one area you're working on. When you get tired, work on the other limb or work on a completely different body part. Take a short break, get right back to it. And by the way, if you're trying to get in shape, this will condition your muscles. You are doing the second half of a resistance training exercise kind of a movement. You're just not doing the strength portion where you would work hard to contract to push outward. You're doing that lightly, and then you're resisting, as in this case we pulled in on the foot. So again, this is the world's single most effective way of loosening up tension from the body. This will take care of acute problems and chronic issues you've had for years. Come by and see us in Temecula. We'll give you a table session wherein you and I are doing the stretching together. You resist against me and I move you, and you will get immense kind of results. Often people say they get more results in 2 or 3 hours of stretching here from me than they do in the same amount of time, or months of physical therapy. Come try it out for yourself, and we will see you soon. Be healthy, be happy.